Thank you very much, Mr. Chair. Assembly Bill 2640?
Yes,
Okay.
please proceed.
Thank you very much, Mr. Chair and Senators. I would like to start off by saying thank you to the committee for working with us on this bill, and I would like to accept the committee's amendments. So I want to state that up front. Thank you for allowing me to present Assembly Bill 2640, which seeks to stop the spread of HIV by ensuring patients have more information about the preventative medications. Current law details what information should be provided to a patient after an HIV test, such as presence of numerous treatments options, preventative practices. Now we need to ensure that those being tested are provided with updated information to accurately inform them about the preventative medication that's made available to them. These medications, known as PrEP and PEP, reduce the transmission of HIV and prevent new infections at the rate of 80 to 99% preventative. AB 2640 will provide those at high risk for contracting HIV within a written information about methods that can be lowering the risk of contracting this virus and will ensure the preventive medications is made available to them. In 2013, California has the second highest number of new HIV diagnoses among the 50 states. Considering the high volume of new HIV infections being diagnosed, it is critical that those being tested are aware of preventative medication today. Here with me to provide supporting testimonies is Aaron Fox with LA LGBT Center and Mr. Dante Morrison with PLA Health and Wellness, who will provide supporting testimonies regarding 2640.
Thank you. Please proceed.
Good afternoon, Mr. Chair and members. My name is Dante Morrison, Program Coordinator at APLA Health and Wellness for the CDC Youth Programs that focuses on HIV prevention and testing for young gay and bisexual Black and Latino men, and I'm here to testify in support of this bill. APLA Health and Wellness is a federally qualified health center in Los Angeles that provides medical and dental care, behavioral health services, HIV and STD testing, and PrEP to more than 8,000 people each year. As you may know, the CDC recently estimated that if current HIV infection rates continue, half of all Black, gay, and bisexual men and a quarter of all Latino gay and bisexual men will be infected with HIV in their lifetime. Passing this bill is a crucial step towards ensuring that these statistics do not become a reality. As one who has worked within the HIV education field for nearly 20 years, I know firsthand how important it is to provide as much knowledge about HIV prevention as possible. The introduction of PrEP and increasing availability of PEP mark a turning point in the fight against HIV. These interventions, combined with other proven HIV prevention methods, have given us the tools to finally bring the HIV epidemic to an end. The World Health Organization now recommends that all people at substantial risk of HIV should be offered PrEP. PrEP and PEP are also key components of the National HIV/AIDS Strategy. Providing continued knowledge about PrEP and PEP to those most at risk for HIV infection is key. It is because of that learning that persons will be able to make more informed decisions about their safer sex strategies. The denial of that information places those who are concerned about their sexual health at a disadvantage. The HIV testing process already consists of information regarding modes of transmission and methods of prevention. By discussing PrEP and PEP during that encounter, patients will receive clarifying information that will debunk stigmatizing messages that created a divisive uproar within gay communities, particularly those of color. It is important that we do our part to ensure that everyone is provided adequate and unbiased information about PrEP and PEP. The facts have proven it to be a successful tactic in the fight against HIV. As we continue to combat this global epidemic, we must ensure that we do our part to remain at the forefront of prevention. PrEP and PEP is a positive addition to the Safer Sex Toolkit. Providing education about PrEP and PEP during HIV testing should be as common and normal as discussions about the importance of condom use. This is a common sense bill to ensure that when someone receives a negative HIV test, they also receive information about how to stay HIV negative. Thank you.
There we go. Thank you. Good afternoon, evening, Mr. Chair and members. My name is Aaron Fox, and I work for the Los Angeles LGBT Center. We are the largest LGBT organization in the world and also one of the largest providers of both LGBT-specific healthcare and HIV care treatment and prevention services, community-based here in California. I was born in 1981, and so as a gay man, I've never lived in a world that didn't have HIV, and it was always something that was in the back of my mind. Every time that I either had sex or thought about my sexuality, it was always often in the context of HIV. And so I began my work in the community much like Dante, as a health educator and also a certified HIV tester here in California. And I think that we're at one of three sort of watershed moments in the fight against HIV. First, identifying the virus and having a test for it. Second, the advent of antiretroviral medications in 1996 that allowed people to continue to live fuller and healthier lives. And finally, we now have a prevention method to offer the community that goes beyond the standard prevention methods that we've had since the beginning of the epidemic. We believe that California should be a leader in ensuring that HIV no longer impacts our communities, and we believe that we can get to an HIV-free generation. In the last 2 years, on the budget side, the legislature and the governor have appropriated $2.2 million for PrEP navigation services in California. And just last week, the governor signed the current budget for the next fiscal year that includes $1 million to actually help people afford PrEP, as it can be very expensive. And so we think this is the next logical step. We're able to get people access to treatment, but we also have to ensure that they have the knowledge. In 2015, the California HIV/AIDS Research Program surveyed over 600 young gay and bisexual men in California and found that less than 10% had ever taken PrEP. 85% had never talked to their doctor about PrEP. And Black and Latino young men were less likely to even be aware of PrEP than their white counterparts. Clearly, information about this revolutionary tool is not reaching those who could benefit from it. And we have worked with our friends at the California Medical Association, the California Hospital Association, to ensure that this bill does not disrupt doctor-patient relationships. In fact, we believe that by passing this bill, we'll be encouraging open dialogue between doctors and their patients about sexual health. This bill will serve to strengthen relationships between doctors and their patients. And we do not believe that, especially with amendments that have been accepted, that this bill does not place a burden on the provider or the person being tested. The bill simply requires a medical provider or someone who administers an HIV test to a person who is at high risk and ends up with a negative test to receive information about forms of HIV prevention, including PrEP and PEP. While significant disparities exist, HIV is a disease that knows no color, no age, sexual orientation, or gender identity. And if we're truly going to end the spread of HIV in this state, everyone at risk must be empowered with accurate information about preventative options available to them. I just wanted to address some of the concerns that have come up in opposition to this. One is that a notion that CDPH would have to develop information. If you were to go on the CDPH Office of AIDS website, you would see that there are already 2 documents, one for providers and one for clients, specifically around PrEP. Project Inform, which is a nonprofit organization, freely gives out information on cards about PrEP and PrEP to medical providers. In addition, there is fully available, accurate information on the CDC's website that is easily printed out and publicly available to anyone who wants it, including providers. One of the other concerns is that codifying the words PrEP and PEP will somehow limit the ability of testers to do their jobs because there's sort of a changing or fluidity around HIV prevention. And in some ways this is true. But PEP has been around since 1988. And while the drugs have changed that are used for the intervention itself has not changed. PrEP, for instance, right now has one drug that is used for PrEP that's approved by the FDA, but going down the pipeline, ideally, we would love to have injectable PrEP. So someone would not have to take a pill every day and would have to get an injection every quarter, so 4 times a year. While the methods may change, the interventions themselves don't. And so we don't see that as a barrier to making sure that people have access to really this game-changing, revolutionary prevention method that unless we really get out on the street and make happen, the statistics that Dante talked about will unfortunately continue to be the same. And we think this is the next step that California can take toward getting to an HIV-free generation. Thank you.
Anyone else support? Name and position.
Greg Herner on behalf of the California Life Sciences Association in support.
Thank you.
Craig Pulsifer, AIDS Project Los Angeles, also in support, and San Francisco AIDS Foundation had to leave early, but also in support. Thank you.
Thank you. Opposition?
Mr. Chair and members, Stuart Thompson, on behalf of the California Medical Association. I'd like to thank the author, the sponsor, and his staff. We've worked out language that will remove our opposition. Our concerns were not every negative HIV test does this information have to be provided, but should be provided to those individuals that are high risk. Author has our language, and we'll be removing our opposition as soon as it goes into print. So thank you.
Thank you. See me.
Mr. Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation. We saw the amendments yesterday. They still don't remove our opposition. And I hadn't heard Mr. Gibson say he was going to take those amendments, so I'm assuming he will based on what Mr. Thompson has said, the new amendments. But we are still concerned, even if those amendments were taken, that we are dictating to the provider what needs to be said to the patient and treating every patient the same way. What we should be doing is leaving it up to the provider, whether it's a physician or an HIV counselor or somebody at a test site, who is determining based on the needs of the individual what that person needs to be told. Do they need to be told about PrEP if they are a married man who cheats on his wife once and is not going to do it again? Do we want that person to be taking a medication with a toxic side effect for months or years in the future simply because he made one mistake? We need the provider to make that decision, not the statute. And so for those reasons, we continue to oppose the bill. Thank you.
Thank you. Anyone else? Opposition?
Mr. Chair, Alex Hawthorne on behalf of the California Hospital Association. We align ourselves with the California Medical Association and will remove opposition once those amendments are taken.
Questions, comments from any of the members? Seeing no questions or comments, is there a motion?
I'll move the bill.
Senator Hall moves the bill. Would you like to close?
Thank you very much. Senators, I know it's been a long day. I would just respectfully ask for an aye vote.
Thank you. We're at item number 18, AB 2640. Call the members, please.
Hernandez.
Aye.
Hernandez, aye. Nguyen. Nguyen, aye. Hall. Hall. Hall, aye. Mitchell. Aye. Mitchell, aye. Monning. Aye. Monning, aye. Nielsen. Pan. Aye. Pan, aye. Roth. Aye. Roth, aye. Wolk.
Thank you.
Nielsen, no.
Nielsen, no.
Currently 7-1. That bill is out.
Thank you very much, Senator.
Thank you. We're at item number 16, AB 2424 Gomez, Community-Based Health Improvement and Innovative Funds.
Great bill, Mike.
Thank you.
I thought you were saying great bill before I even presented. Thank you, Senator.
Great bill, Mr. I have to hear yours first.
Great bill, Mr. Gomez.
Chair and members, Assembly Bill 2424 would create the Health Improvement and Innovation Fund to ensure that the opportunity is available for Californians to achieve optimal, equitable health regardless of their socioeconomic status, race, ethnicity, or place of residence. Specifically, money allocated from the fund will support sustainable programs whose goals are the advancement of public health through preventative care, particularly for those living in disadvantaged communities. Unfortunately, our budget proposal to include funding for this purpose was unsuccessful. However, it is worthwhile to establish the fund in the statute to ensure that public health and local preventative efforts are not neglected. This bill has received input from a large variety of disease prevention stakeholders. It has support from many major health organizations. AB 2424 is an answer to the question, how can we prevent costly and deadly chronic disease in California? The question of where the funds will come from must be answered in the future, but the initial question remains, and it is important to answer. By establishing this fund, we make clear our priorities as a legislature and as a state. This effort will inform future funding efforts. That's why I believe this bill must pass. A lot of the chronic diseases and the health disparities we see throughout California are based from the fact that we do have multiple sources and multiple impacts on people's lives, everywhere from where they live to how they work, their nature to the access. And I know we've been trying to address all those through the Affordable Care Act and other means, but we still have disparities when it comes to cancer rates among individuals. One that I cite is that a African-American woman is more likely to die of breast cancer than a white woman, even though the incidence is higher in white women. Why? Because it's often the African-American woman that gets their diagnosis later, in a later stage, and often doesn't get the care that they need. So this is something that we need to kind of look at holistically, moving from the first generation of the health system, the second generation where we're at now, trying to cover people, and at the same time, making sure that now we're focused on if somebody gets hurt, somebody gets an illness, that they take pills, they get patched up, but they live with this long-term chronic disease. We need to move on to that third generation where we actually stop those diseases before they even begin. I ask for your aye vote.
Anyone in support? Please proceed.
Thank you. I'm Dr. Lynn Silver from the Public Health Institute, also convener of the California Alliance for Funding Prevention, whose concept paper was part of the background. I won't repeat the Assembly member's excellent words about the public health and social justice importance of these measures, and I'm going to talk about something that as a pediatrician I don't usually talk about, which is money. This bill will, and why we should pass AB 2424. Simply put, our state is failing to prevent the largely preventable chronic diseases and injuries that kill us the most, kill poor people more, and cost immense amounts of money to our families, to our state, to our insurers, to our employers. It is time to change that. AB 2424 would codify the intention of this body to do so by creating the Community-Based Health Improvement and Innovation Fund. AB 2424 would help keep patients' insurers in the state of California from paying those bills you just spent an hour discussing a little while ago. And it's part of why it's so important for us to do this. Just last week, Professor Tim Brown of UC Berkeley published new research examining the return on investment for expenditures in public health in your California counties. For every dollar invested, he found a whopping $67 to $88 were saved, many times higher than the return on investment of our massive investments in healthcare. So today we pay for preventable heart attacks, for diabetes, for amputations, for people going to dialysis units, but we do not fund our communities to implement the simple evidence-based measures that can prevent these diseases. It is time to change that. The excellent legislative analysis also highlighted many of these issues and their impact on the state. As the Assembly member said, this bill received input from health officers, health directors, the Heart Association, the Cancer Association, the primary care clinics, and others have helped formulate these ideas and provide support. While our budget proposal was unsuccessful, and it will be left for next year to answer where the money can come from, there are many good potential options that we would have to define, yet it is extremely important for you to define this fund in statute now, and make clear the intent of the legislature that preventing these conditions is a priority. Just for example, last year, this body decided that healthy food incentives for low-income residents was an important thing to keep people healthy. The law was passed, it got no money. Last week in the budget, the first funding for healthy food incentives was approved. We hope that this bill will open a similar door for future funding for chronic disease prevention, and indeed the provision on community food projects would specifically fund healthy food incentives in the future if this mechanism is funded as one of its activities. I'm aware of no negative impacts of this bill, and of course, when funded, in addition to saving money, it would save large numbers of lives and reduce the biggest sources of health disparities. Our longstanding failure to act perpetuates an unacceptable status quo, so we strongly urge the Senate to pass this bill this year and lay out a path for a healthier future. Thank you.
I'm Dr. Mark Horton, a pediatrician and prior state health officer and director of the California Department of Public Health. Let me try to lend a sense of urgency to this bill. There are 2.5 million individuals in California with diabetes. There are another 13 million individuals with pre-diabetes, 15% or 2 million of which will go on to develop full-blown diabetes in the next 5 years. This is a tsunami of increased incidence of diabetes, which is going to significantly stress our healthcare system, lead to significant costs, and a lot of disease and disability. We know how to prevent diabetes. There are evidence-based prevention interventions in place being implemented in many communities around California, but the resources are woefully inadequate to bring those kind of evidence-based prevention interventions to scale and really have an impact on the incidence and rate of newly diagnosed diabetes in this country. What we need is urgently are resources to our communities that can implement these evidence-based preventions and significantly impact the incidence of chronic diseases in our communities. Please pass this bill that sets the framework for future investments in chronic disease prevention. Thank you.
Hi, Kat DeBerg with the Health Officers Association of California, in strong support. Also was asked to voice the support of the American Heart and American Stroke Association.
Thank you. Anyone else?
Kimberly Chen with the California Pan-Ethnic Health Network, in strong support.
Thank you, Ms. Chair. Members, Christopher Castillo on behalf of the Sonoma County Board of Supervisors, in support.
Judy Bowen with California Hospital Association, California Naturopathic Doctors Association, in support. I apologize.
Amanda Guadarrama with Beringer Ingelheim, in support.
Jerry Jeffy, California Chronic Care Coalition, in support.
Autumn Ogden with the American Cancer Society Cancer Action Network, also in support.
Betsy Armstrong with the County Health Executives Association. We're actually in a support in concept, working on some technical amendments that hopefully get us to a full support. Thanks.
Thank you. Opposition? Questions, comments? Senator Monning.
Thank you, Mr. Chair. I want to thank the author for bringing this forward. In reviewing the bill, though, it focuses on the promotion of healthy environments, safe places to be more active, promotion of healthful food. I don't see any reference. The bill is silent on addressing contributing factors to this diabetes epidemic. Would you be open to focusing on those diet contributors in our communities, like sugar-sweetened beverages, that medicine, not politicians, has concluded is the leading contributor to preventable diabetes?
In the fact sheet, if you look at it, it actually states adolescents in Medi-Cal reported significantly higher rates of drinking sugar-sweetened beverages and less consumption of vegetables. So it's something that is, I think, implied in the bill. We listed in the fact sheet, but it's also kind of a lack of, what I was trying to do is look at a comprehensive view of environmental factors that impact individuals' health. Environments are complex, right? Let's just take me, for example. I'm in this environment up here in the Capitol. We tend to eat very bad foods. I don't drink sugary beverages, maybe a Diet Coke here and there. And if Pepsi was watching, maybe a Diet Pepsi once in a while. But it's just a joke. But but recently I got a blood test that showed that, my blood sugar glucose level is really high. So I have to start kind of taking a lot of steps into changing the environment. I banned all candy just this week from my office, and my chief of staff is known for having a candy basket in his every office he served. So, yeah, we can definitely look at doing that.
It sounds like you're a comprehensive approach to public health crisis. Part of that comprehension, I believe, has to look at issues like tobacco, sugar consumption. Also have a funding tool that you might want to consider, since you didn't get the money out of the budget.
Yeah.
Both Mexico and the UK are currently funding massive public health programs with a tax on sugar-sweetened beverages. Do you know what a 1 penny per fluid ounce tax in California would generate for your program in the first year?
I do not know.
$1.8 billion. That's California franchise tax board. So you know that I'm passionate about this issue, but we share the passion for not just addressing public health threats and epidemics, but to come up with solutions. And I'm fully supportive of this. I just urge that you be fully comprehensive and creative in finding funding sources. If it's not forthcoming out of our budget, then let's tax the products that are causing damage to our communities, like tobacco. We tax tobacco. Let's tax sugar-sweetened beverages and fund this program.
No, and I definitely see what you're trying to get at. What I was trying to do, getting it out of the general fund, is I was trying to get an overall commitment from the state that this is not just regarding one industry or one entity, but it's something that the entire state should care about. And also at the same time, understanding the difficulties different individuals have had passing those kind of bills. So sometimes take the partial victory of getting the bill passed. At the same time, the overall food we consume here in the United States and just now globally is being crafted in a way that everything is starting to have kind of the processed food is bad for you. Because they have this thing called within the industry now, something called the sweet spot, where they add enough sugar and enough salt, but not that you can tell. And products that never had sugar, the products that never had salt, all of a sudden they're adding a little bit in order to kick out that craving. So it's not just soft drinks, it's bread, it is processed foods, it's all sorts of things. I never knew when I was poor and my parents fed me beans and tortillas, I was actually healthier then than I am now. It's a big problem and we have to break it down and figure it out. And in the end, I think the large companies, the soft drink manufacturers, they understand that is a trend that is moving away the consumption of the sugary drinks. So they're buying up, different whole food and whole food products. And not just to kind of, and also that's where a lot of their margins are starting to come from. But you're right, Mexico, I was talking about this to my aunt. Mexico used to be a fairly fit and healthy country. And as the American diet has permeated that country, now they're the most obese in the entire globe, right? I used to always say that my family in Mexico was in better shape. Now I can't say that as much.
Well, Assemblymember, I look forward to our continued work on this. I'm supportive of your bill today.
Thank you.
And again, I just think we do need to rely on the public health experts who don't say all foods are equal. There are certain culprits that are damaging our communities more than others. But I'm glad to support the bill and move it at the appropriate time. Thank you, Mr.
Senator Mitchell, I believe you had a comment?
Just very briefly, I appreciate your focus on the environment. In a previous life, when I led the Black Women's Health Project in South LA, and we partnered with American Heart Association, had a Walking for Wellness program, and the women in South LA told us we are at greater risk of harm to our health walking in our community than sitting on the couch. And so talking about environments that all people live in and how environments may not be conducive to healthy living. The California Endowment study that shows life expectancy can be determined based on your zip code. Those are critical elements that we as policymakers have to focus on. So I appreciate your focus on environment in the bill and hope that I can partner with you in your efforts.
Senator Pan?
I too want to thank you, Senator Gomez, for bringing this up, and it's great to see 2 pediatricians testifying who are involved in public health. And one of the other areas that I also hope is we're looking at chronic diseases, and we look at the social determinants of health is actually we call intergenerational impacts, and I know that's something that many of us, and I particularly want to recognize Senator Mitchell on working on some of those issues because as we're looking at toxic stress and adverse childhood events, we often look at that in terms of, well, what's happening in childhood, but actually, I mean, there's already been longstanding studies that show, for example, developing chronic stress in childhood then leads to high blood pressure, other chronic diseases in adulthood, and of course, higher rates of mortality. So some of these studies on social determinants of health, I think, give some indication about directions we should be looking at. And the other part on the financing side, I know one of the criticisms, there's no money in there right now, is that as we are tackling these issues, we are actually reducing other things we are spending money on right now in our state, whether it's increased costs for in terms of on the mental health side, if we're not addressing these issues on the education side, because in terms of special education and other types of things, obviously on chronic health and Medi-Cal and so forth, and even amongst our own state employees and others. So hopefully, as we're looking for, as this moves forward, there's a way to capture that piece so that this effort, people need to recognize, will actually more than pay for itself in the long run. And I appreciate your efforts. Thank you.
Well, thank you.
And see no further questions. Was there a motion? Did somebody move it? No. Monty.
I think maybe Mitchell before me.
It's a dual motion.
We'll give it to Senator Monty this time. This item, would you like to close?
Thank you. I know everyone here has been working on a long time these issues. This is actually one of the first bills I've stepped out on health issues, and the reason why I was letting a lot of the Affordable Care Act kind of settle out. But it's not going to be taken care of in one bill, and it's not going to be taken care of one session. I look forward to working with all of you.
Item number.
And ask for your aye vote, of course.
Do pass as amended to appropriations.
Secretary.
All the members.
Hernandez?
Aye.
Hernandez, aye. Wynn? Wynn, aye. Hall? Hall, aye. Mitchell? Mitchell, aye. Monning? Monning, aye. Nielsen? Pan? Pan, aye. Roth? Roth, aye.
Thank you.
Current vote count is 7-0. That bill is out.
Thank you so much.
Item number 20, AB 2747, Hadley Chronic Dialysis Clinics. This is support on both sides. And there's, please present.
You're on a roll. I know how to take yes for an answer, Mr. Chairman.
Ask for an aye vote?
Respectfully ask for your aye vote.
Accept amendments.
Will you be accepting the amendments, correct?
Yes, we'll be
Is
pleased to
there
accept.
support?
Thank you.
Thank you, Mr. Chairman and members. Michael Arnold, representing the California Dialysis Council. I just want to make sure that the committee is aware that there are very, very ill dialysis patients throughout California, many of them in your districts, who have to be transported 3 times a week to dialysis care, 3 hours at a time. And currently, they are driving by brand-new dialysis clinics that are sitting for 12 months before they are surveyed and given a license and given certification under the Medicare program. We can't figure out why it's happening, and these poor patients are put in this situation because of bureaucratic, a bureaucratic situation that we simply can't fix, but we hope this bill will move us forward down the road toward fixing it.
Thank you. Anyone else support?
Angelica Gonzalez with Kaiser Permanente in support.
Thank you. Opposition? Questions, comments? See no questions, comments. Yes, move the bill by Senator Hall. Would you like to close?
Respectfully ask for your aye vote.
Thank you. It's do pass as amended appropriations. Call the members.
Hernandez?
Aye.
Hernandez, aye. Wynn? Wynn, aye. Hall? Hall, aye. Mitchell? Mitchell, aye. Monning? Monning, aye. Nielsen? Nielsen, aye. Pan? Pan, aye. Roth? Roth, aye. Wolk.
Current bill is 8-0, it is out. We're going to go ahead and lift the call. We have item number 5, AB 1051, due pass as amended. Call the absent members.
Nielsen, aye. Pan, aye. Wolk.
Current vote count is 8-0. That bill is out. We have the consent calendar. Call the absent members.
Nielsen, aye. Pan, aye. Wolk.
Current vote count is 8-0. That bill is out. That concludes the business of the Senate Health Committee, and we are adjourned.